Good morning, folks. So, as you can tell by the thumbnail, today we're going to be talking about the absolute state that is Newfoundland's healthcare system. A little bit of background, the term state. In Newfoundland, I suppose linguistics or language, the Newfoundland dialect, we use some words differently than other English speakers. For example, when we say that something is, there's a state, it generally means it's in a state. There's a bit of, I guess, linguistic shorthand would be the right term for that. One moment. I do apologize if I blind anybody with this light. There we go. I keep forgetting to turn on my light. My ring light. But in Newfoundland parlance, if we say something's a state or in a state, it means it's a mess or it's absolutely chaotic, what have you. Of course, in order to fix the state of Newfoundland's healthcare, the College of Physicians and Surgeons is supporting an Atlantic registry for doctors. The idea being that this will allow, here we are, it will eliminate much of the red tape that doctors face in getting licensed in other provinces. For a fairly simplified analogy, it's not unlike the Red Seal system for certifying tradesmen. For example, if you have a Red Seal certificate as a cabinet maker, you are able to show qualification to work within a province anywhere in Canada because it's a nationally accepted, as far as I know, a nationally accepted standard. So what that basically means is you meet the minimum standard required by all provinces. I'm not a Red Seal cabinet maker. I'm trying to find work as an apprentice cabinet maker so that I can eventually work towards my Red Seal. Currently, that's not easy. And damn near impossible in Newfoundland. But, just to return to the story, the registry will eliminate much of the red tape, which is great. It's wonderful that... okay, well, this is irrelevancy now, talking about hospitality in Newfoundland, describing air access. But, given the big issue here in Newfoundland is not doctors being able to come here. The issue is getting doctors to come here. And of course, VOCM is asking in their question of the day, do you think an Atlantic license for physicians will improve access to healthcare in this province? I, of course, say no, because what will happen, or what isn't going to happen because of this registry, is that doctors are going to be drawn to the province. It just makes it easier for them to come here. And clearly, I'm not in the minority on that opinion. What that means is, yeah, it's easier to get a doctor, or it's easier for a doctor to come here if they want to. The problem is, especially here in the community I live in, we have a lot of foreign doctors who come in, serve their time, and it's obviously a chore for them, given the culture that they come from is very different. I've had 8 doctors in the last 7 years, if not more. Generally, they stay here no more than 2 to 3 years, which is probably the term that they agree to when they come here. As I understand it, what is going on is, in order to be accredited in Canada, they must, or in order to be accepted to practice anywhere in Canada, they have to practice in, I guess, places with restricted access to doctors. And what that ends up generally being is, I've had, in the last 8 years, I've had doctors from as disparate places as Nigeria, Iran, Iraq, various Middle Eastern places, for the most part Middle Eastern, and African, and some Asian as well. When I say Middle East, there's that Asian-African divide there, obviously. But it's generally that area that is considered the Middle East where we get people from. I believe I had one doctor from Bahrain as well. But my point being that you don't solve this problem by making it easier to get people to move here. And the number of people who are actually without a family doctor in this province, just this province, is now around 136. Now, this is from January this year, so it's probably the most accurate information we're going to get. Excuse me. But just to highlight the issue, I will take a look at the population of St. John's and the population of Newfoundland as a whole. So the population of Newfoundland is currently 521,549. It's probably not that high. Now, this is 4 years ago. So it's very difficult to be sure. I'm not sure if they've released the census results for us this last census. But as you can see, with 136,000 people not having a family doctor, that's over 20%. Well over 20%. That's very close to 25%, I think. 4 times 13 is 20. Yeah. It's very close to 25%. And if we then take the population of St. John's, which is 113,000, more than the population of the capital city is without a family doctor. Now, granted, the doctors in St. John's probably see a lot of patients, but the biggest issue we have, of course, is retaining doctors. It's fine to say you have a family doctor. Even the 475 odd people who still have a family doctor in this province don't generally have one for more than, and as I've said, the term of about 2 to 3 years. So we're having a real problem with getting doctors to stay in this province. It's not just attracting them. They're using Newfoundland as the portal to Canada. Makes total sense. If you live in the Middle East and you want to immigrate to Canada, the first airport you're going to hit in Canada is St. John's. Now, it's quite possible, or Gander, the international airport. And the problem there is these people are coming in, and it's no slight to them, not by any means, but they're coming in from another culture, so they're going to feel isolated in rural Newfoundland anyway because there's such culture clash. It doesn't help that if some doctor has a fairly Arabic last name, what's really irritating is even when they're fairly simple Arabic last names, like, say, Al-Aqidi, A-Q-I-D-I, which the average person couldn't look at and go, well, yeah, it's an Arabic name, so I pronounce the Q as a K, and the I as an E, so it's Al-Aqidi. Not particularly hard, if you're at least a little bit well-read. Even the nurses and the administration in some of these places, some of the hospitals around the area, will not go out to that much effort. They'll actually refer to these doctors by their first names. Prestige is important. Status is important to these doctors. They want to be referred to as Dr. Al-Aqidi, Dr. Al-Mazari, whatever their last name happens to be. And I've repeatedly had doctors surprised that I know how to pronounce their names in Arabic. Part of the reason I do is because I've been elsewhere, and I've taken the time to educate myself on doing that. Newfoundlanders are supposed to be hospitable. Well, part of being hospitable is being respectful of someone else's name. Unfortunately, a lot of people won't put out that effort anymore. Personal responsibility. But just to return to the issue here, of course, the number of people without a family doctor has risen to 136,000. I'm not quite sure why they chose to use an Asian doctor and an Asian patient here, considering they're among the lowest population in Canada, in Newfoundland. And in Canada, they probably make up 10% maybe of the entire population. But this number, based on a narrative research poll from the summer, represents more than 136,000 people living in Newfoundland and Labrador based on population data from that time. Family medicine is facing a crisis due to physician shortages, closures of rural emergency departments, which we will come to shortly, and a workforce struggling with increasing demands and mounting overhead pressures. Let me see. So that's about an 8%, or around a tenth, from the most recent poll from last year. So obviously the problem is accelerating. And having another look at this, the ER closures across Newfoundland mean last year's problems will only get worse in 2023. Absolutely true. It doesn't help that during the... Still on YouTube, had to be careful how I say it. The virus, I'll just leave it at that. During the virus, the last 3-4 years, not only were emergency rooms temporarily closed, quite often, a lot of elective surgeries and a lot of non-elective surgeries were simply canceled. Cancer treatments were canceled. Cancer screening was canceled. And this has led, of course, obviously, under the category of no shit Sherlock, to massive problems where a lot of people are much sicker and in far greater need of care, far more desperate need of care than they would have been if the policies that were enacted had not been enacted. Really starting to think I should get off of YouTube if I'm going to talk about this at all. But the biggest problem, and of course they say closed over the holidays. Well, that's not true because one hospital's emergency room has been closed since June. And this story is from January this year as well. So what we're seeing is... Don't want to show an ad for toenail clippers. What we're seeing, though, is people are being placed in jeopardy. People's lives are being placed in jeopardy. And one simple solution to this comes to mind. But before I go to that, I want to talk about this particular graphic here. Assuming this is Whitburn. This is the sort of distance you're looking at. That's an hour. So let's say someone shows up here with a life-threatening injury at this particular emergency room, unaware that the department has been closed. They see this giant sign, they look at their hand that's half lopped off and bleeding profusely, and they are basically told, oh, you've got another hour before you can get help. Are you fucking kidding me? Yeah. So what do I think is the solution to this? Well, a lot of people aren't going to like it, but we need to at least go 2-tier on our healthcare system. If there was a paid system, it would give at least some incentive for doctors to remain in the province, especially geriatrics. Anybody working in geriatrics right now, that is the moneymaker right here. Because our population is getting so old. Matter of fact, I'm curious about the average age in Newfoundland. The average age in Newfoundland is 43.7 as of the 2016 census. Which also makes me wonder, why is the 2021 census not out? Okay. Release plans. And I'll throw this back on screen as well. Starting February 2022, Census team has planned 7 major releases. Bugger off website survey. Of population data products. On the completion of the 7 major, there will be further releases which will highlight... Okay, so what are they planning to release this year? Commuting reference guide, education guide, housing characteristics reference guide. Okay. So, not only is the Liberal government that was elected on a promise of transparency being even less transparent, they're being super slow to release information that they basically forced us to give under penalty of law. Yeah. Okay. Here's my solution. And as much as I dislike it, it will be an effective solution for the healthcare crisis. At least it will help stop the slow drain, not so slow drain, of doctors. If you make it possible for a doctor to actually practice medicine for profit, for reasonable profit, if the over and over you guys have heard me say government needs to get the fuck out of the way. This is another example of it. Yeah, universal healthcare sounds good, but it can't work because there's not enough people paying into the system. You should have the ability to opt out, or not necessarily opt out, but you should have the ability to say, okay, I don't want to wait 6 months for a fucking test that's going to tell me if I'm going to live or die when I'm not feeling well. I want to be able to go to a testing facility and say, hey, here's $100, $200, $300, $500. I need to get this test done. Okay, you get the test done. Right? MRI, whatever. If you need it in a hurry, it's done. One of the other things that really bothers me one of the things that's come to mind now, is I'm curious about athletes in this province, professional athletes. We have a few, I guess, minor league or not quite major, semi-major maybe. I don't know exactly what the terminology is. Not a sports guy. But where do these professional athletes get their care? Do they push someone else out of the queue so that they can get care in the universal system? Or are they paid? What do they do? Do they fly them to Nova Scotia somewhere? Do they fly them to the States? And if they do, well, doesn't it make more sense to the government to go, wait, why are we doing that? We're letting tax dollars go away. It's tax revenue that's being thrown away. I'm not even a business person, and I can see that. So, yes, yet again, we run into the problem that politicians are kind of dumb, or at least self-serving, and therefore myopic. But my big issue with all of this is that government doesn't seem to have the best interests of the people at heart anymore. Because if it did, it would say, okay, yeah, we need to allow people to be able to skip the line. And the only way they can skip the line is if there's another facility. If you want to make it fair for them to skip the line. Otherwise, what you're doing is saying, okay, you can skip the line, you just pay the physician X, and you get to push the queue back a space so you can get in there. That's hardly fair when we already have some of the longest wait times in the fucking world. Sorry, in the developed world, let alone the rest of the world. Crazy. And I mean, let me know what you guys think. Do you think a 2-tier system is the way to go? Do you think full-on 4-pay is the way to go, similar to the States? Now, even in the States, there are places where they don't have... There are places, charity hospitals, things like that, where you can go to get care. It's not great care, it's basic care, but still basic care. Can't even get that in an emergency room in Newfoundland, some places. That's really, really infuriating. Anyway, guys, I'm coming up on 20 minutes. Didn't really have a lot to do on this topic. Next week, I'm going to try to do the Truxton and Pollux. I meant to do it today because it was close to the anniversary. Didn't happen. Those of you who are familiar with the Truxton and the Pollux disaster, I know Stormy is one. She's from one of the towns that was involved. It's the story of how 2, I think possibly 3 U.S. vessels during the war kind of ended up grounded on the beach, or beached, I suppose, run aground, run ashore, whatever term. And the reaction of the community, and communities, I should say, are in the area to help these men. One of my favorite anecdotes from that is about a woman who kept trying to scrub a man's skin clean, only to be told that he was black and that was the color of his skin. Isolated communities. What are you going to do? Anyway, guys, I hope you're having a good day. I hope you continue to have good days and rise again until lambs become lions. Bye-bye.